Okay.
Oh, as we continue our coverage of the coronavirus pandemic on Blues Radio International, we're honored to again get in touch with Dr. Janice Johnston in Arizona. Uh, how's it going out there, Janice?
Well, I think that we're just getting rolling, honestly, with all of this. There's still a lot of concern. We're seeing a lot of people calling in with illness, cough, concern that they do have corona. Of course, we're still seeing all the other things too, right? We still seeing flu, strep, earaches, pneumonia, bronchitis, all the rest of it, and it's hard to differentiate between the two. So we're doing our best. We're treating people more with like a shotgun kind of approach, where we're using antibiotics, using Tamiflu a lot, um, inhalers, things like that. But definitely there are some people who are struggling with this. I've seen quite a few that have been diagnosed and then are okay now, but I've seen some where they're pretty short of breath as well.
We have a shelter in place order that was just issued where I am in Broward County, Florida, and we actually lost an internist last night.
Mm.
And so it's a very sobering situation here. What path do you see this all taking?
Honestly, I think it's going to get worse before it gets better. Um, Unfortunately, I think we're going to see a lot more people get ill, and unfortunately, some will die. Even with the ventilators, it doesn't necessarily mean that you're going to live if you get put on a ventilator. Not everybody that gets put on one makes it. Um, but I can see that if we follow the guidelines of what our government and our governors and our municipalities are telling us to do, I think we can definitely make a big impact. But as you know, there are some people that just aren't doing what they've been told, and putting others at risk.
What do you see as something that you've learned over the last week since we last talked about the nature of this disease and the way it's affecting the populations that you treat?
Well, I can tell you exactly how people describe their symptoms. At the beginning, they feel flu like, and so you get the body aches. There's a lot of extreme fatigue that goes along with it. Um, Cough, of course, that you know. It's a dry kind of cough. It's not like a wet, productive type of cough for the most part. They do say that their lungs burn, the real burning kind of feeling. Some are having some gastrointestinal upset with it, some diarrhea with it, and certainly fever. But I've seen people that have had it and they've had no fever at all. Uh, and it can, I think, kind of wax and wane. That's the medical term that we will use, where the symptoms, they'll come on, you'll think you're getting better, but then they'll come back again. So they'll kind of, you really, really need to, sorry, my phone's blowing up. You have to just get your rest and stay home exactly the way you've been told to stay home.
And how are you holding up, Janice? Are you getting any sleep? Are you eating? Are you able to take a breath every once in a while?
Yeah, last week was a very stressful week. I won't lie. It really, really was. I was not sleeping, and honestly wasn't eating like I should. I would go a whole day without even having a glass of water, which is crazy. I know better, but I'm definitely looking after myself now. I am sleeping, which is a good thing, because when you sleep, you can think better.
Yes.
But it rolls through and affects us all at different times, right? And as we worry about ourselves, we worry about our family. My mother is 88. She lives in Canada, and I live in Arizona. And she was sick the last few days. She seems a lot better now, but that's something that I worry about from my end as a daughter, being far away from my own mother and not being able to do anything about it. But she seems to be doing well now, and but everybody has those thoughts in their head, and now we're starting to see things on Facebook of people that have been infected or affected during their death, their family or their friends. And so it's going to happen to all of us. We're all going to know somebody that this has happened to.
You're feeling all right?
I feel perfectly fine. It's funny. Sometimes you get a little something and you're like, oh, I'm getting it, but then you're fine. It's stress right now, but we certainly think that we're at higher risk. We're taking all the precautions that we can of when we're interacting with people, at least the ones that we know are sick. Um, but some people are just going to roll through the doors without us knowing. And, I'm certain probably most healthcare workers are going to get exposed at some point.
There are so many people out there speculating on when this is going to peak. And certainly, I understand there's no perfect knowledge on that, but do you have anything you can tell us based on the learning that you have out there on the subject?
Yeah. I've been, reading a lot of Lancet articles and really trying to learn about where doctors have studied in other situations to get a better idea of what we need to look for in terms of the symptoms so that we don't miss anything with symptoms and the progression. But it from the models that I've looked at, it looks like, our peak is going to probably be about 4 weeks or so. That would be my guess. But it all depends on spread. And, if we can contain the spread, you're going to contain the peak. And that's really what all this social distancing and isolation is all about.
Are there some practical things that might be within everyone's reach? I mean, not exotic medicines, but just things, supplements or routines that we can adopt?
So I actually have the pleasure of having a couple of naturopathic physicians on staff at our facility. And I asked them that question because, what can we do to help boost our immune system? The obvious things, getting your fluids in you, making sure that you're hydrated, making sure that you're getting sleep, and making sure that you're staying on your regular pattern of sleeping and waking. A lot of people, if they are isolated at home right now, they're stuck on Netflix, which is not a bad thing, but you do want to just keep your natural sleep-wake cycle, and I think that that's really important. Certainly, if you can get some exercise, and that's going to be limited if you're stuck at home, but there's things that you can do at home to keep yourself active. Vitamin C, we definitely think is helpful. Emergency, where you put it into water. You could just put a slice of lemon or an orange into your water and just get some extra vitamin C that way. We do think just even a lot of herbs that you have in your kitchen right now, or maybe growing in your backyard. A few weeks ago, I actually bought it's called a tower garden. This was before knowing that how important growing your own food would be at home. But I have a lot of different things. I have mint and cilantro and all sorts of things that are growing out there. So, if you can get some seeds and start growing things on your own, you can get some fresh herbs. And we do think that is helpful.
We talked about this dramatic equipment shortage that you were facing the last time we had a discussion, and that you didn't even have the things to protect your staff. Has that gotten any better since we last spoke?
Well, we've gotten a shipment of just the regular surgical masks. We've gotten some of those, and we've gotten the surgical mask with the eye shield. We're still waiting on N95s to come through, so we currently are still just reusing the N95. So I keep my own. I have it in my backpack, which obviously is not ideal. It's in a Ziploc bag. I saw a couple of patients today was able to wear the whole get up with the bonnet and the shoe covers and everything else, but you're supposed to dispose of all that right afterwards. And so I did dispose of the gown part of it, and of course then I had another one. So I did not have everything that I needed. We are doing our best right now to consolidate all of the patients that we're screening ahead of time with telemedicine, to screen them through to one center instead of having them go to all 5 centers, so that I can steward our supplies in a much better way.
What can all of us at home do to help you as physicians and medical professionals through this? Obviously, everyone's in a state where we've got a lot of questions about our various concerns, but what can we best do to help you at this point?
I think the first thing is to stay home. And if you're sick, stay home. Reach out through telemedicine and get some advice as to what to do. the last thing that you want to do is just run to your doctor's office or show up unannounced and may infect other people or the healthcare workers. They need to know what's going on with you before you roll through the doors. Make sure that you're still looking after your chronic issues too. And so telemedicine is a wonderful way to do that. So I can talk to you about your diabetes, your depression, your thyroid, your this, your that, your frozen shoulder. I can do a lot of things just remotely and give you guidance. That keeps you home and keeps you safe. And it keeps your doctor safe as well too. And it keeps your doctor working so that they can continue to provide care to others, keep their staff employed, and all of that. So I think just being really, really wise and cognizant when you feel like you need care. Now, if you're needing emergent care, you're going to have to go. I mean, I've seen so many people where they should be in the emergency room and they come to us. And there's only so much that we can do in primary care. We're doing more and more, obviously, but sometimes you have to go. So.
How about there's an enormous swath of the population that goes to the emergency room for their primary care just on a daily basis in this country in many urban areas. What's happening in that situation?
I haven't had a moment to chat with my ER physician friends to see what's happening, but I can tell you what patients have told me, that the ER is oftentimes turning them away, which makes sense because they've got, bigger fish to fry and more acute patients to look after. So telemedicine is a key thing for that. I know that the Centers for Medicare and Medicaid opened up telemedicine to all people with Medicare and Medicaid, whereas before that was a barrier to care. And now, of course, they could get their primary care issues dealt with through telemedicine, which I think will be very helpful.
Dr. Janice Johnston, thank you for taking the time to speak with us again today. You were overworked, but you are very much appreciated, and we can't thank you enough for what you're doing for all of us and for joining us here.
All right. Thank you, Jesse. Thank you.
Thank you.